Hello everyone, Dr. Levi Bradburn from Active Care Chiropractic. Today I wanted to talk to everyone about proper squatting mechanics. The majority of times when I see patients, they're not squatting correctly. They've either learned incorrectly or they're trying to squat correctly, but their muscles just can't allow them to get in the positions that they need to. So what we're going to address is how to do the proper squat and then some of the things that can limit people from getting to the proper squat. So the first thing you want to check is there's a few motions that happen with the squat. The biggest, most important is going to be your hips. You want to use your hips for the motion. Your hips have a lot of range of motion to be able to move to get down in that position rather than your knees, which can only extend. So if you're looking at someone from the side, the hips should hinge and drop down just like that. These should be the primary motion. The majority of your muscles to do squatting is in the legs, so you want to use those legs, not your back. So that's the other thing you're going to look at is the back. You want to see the back stays straight. You don't want to see it start hunching forward like this. That causes back problems, puts more strain on the disc, can cause herniations and bulges. Looking at the knees, you want to see when someone is doing a squat that the knee does not cross in front of the toes. If the knee is going in front of the toes, now all of your weight is going to be going right through the knee and going down in this direction rather than being dispersed and going down through your heel. So now it's going to set you up for having a lot of knee problems as well in the future. When you're looking at someone from the front, what you're looking at is the knees again. When someone's coming down, you want to see the knees line up the same way as your feet. You don't want to see that the knees will do the most common way that I see is people's knees will cave in. Whether that's from tight adductors in here pulling the legs in from sitting all the time, or even weak IT bands not able to hold the muscles out. So now, if we're coming in like this, all the weight is going to go down through the knee, creating torque on the knee, causing a lot of problems, especially on the inside of the knee, and now people start having knee pain. So again, we should see more like this, right in line with the feet, so there's no torque or twisting on there. So again, a lot of times people will know what they're supposed to do with these squats, but they can't. Their hips don't have the range of motion because there's scar tissue built up in there, or their ankles don't have the proper range of motion, or there's something going on with their knees that prevent them. So that's why doing the active release therapy, we can break down the scar tissue, the adhesions, find out the source of this, get it corrected, but then also correct the problem, which might be the squat, that you're not squatting correctly, so this stuff doesn't continue coming back. So these are all the things that we'll address whenever someone's in the office to make sure we're getting the whole problem, getting the whole root cause of everything corrected. So thanks for stopping by today.